On this edition of Veterans Health Watch, we'll learn how volunteering can contribute to the projects and activities that enhance the lives of veterans throughout the VA Maryland healthcare system. We'll also talk to a veteran about the rewards of volunteering. So please join us. Welcome to Veterans Health Watch, a program sponsored by the VA Maryland Healthcare System that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. The VA Voluntary Service Program, one of the largest volunteer programs in the federal government, has been in existence for more than 65 years, with volunteers donating more than 750 million hours of service. And joining us to talk about the local VA Maryland Healthcare System volunteer program is Susan Kern, the Voluntary Service Program Manager. Susan, thank you so much for joining us.
My pleasure.
Well, Susan, I know that volunteers play a large role in some of the more nationally recognized holiday seasons. What can volunteers do throughout the year to help our veterans?
We have a large number of possibilities for volunteers, and they range from very patient-centered oriented volunteer positions to some positions where people are more in the background doing things maybe not right around patients, but doing things that ultimately will help patients. To be a volunteer is a real honor, I think, for individuals, particularly if you're going to be helping our veterans. But there are a lot of fun things that you can do. If you want to be around patients, we have all types of volunteers that help with hospitality, with visiting with patients, with in our therapy departments, doing things directly with and for our patients. We have volunteers that go out in the community, which I believe is one of the programs we're going to be talking about a little bit later. So you have the opportunity to volunteer in a VA facility, but you can also volunteer in the community with VA programs that we have. And I think that's kind of exciting too as well.
Yeah, I did talk to a veteran, and we'll hear more about that, about working in the community. How can a person get started as a volunteer in the VA Maryland Healthcare System? What should they do?
Best thing to do is call one of our offices, and we do have 3 offices that are staffed by VA employees, and you can get the initial information that you need. There is an application process. Fill out an application. There's some other paperwork. After you get that into us, then we do some background checks on all of our new prospective volunteers. And it's nothing that costs a new prospective volunteer any money to do, but we do fingerprint all of our new prospective volunteers. And that's really important because our veterans are such precious individuals. I don't think anybody wants to have people coming in that wouldn't be quite suited for being around our veteran patients. So following the fingerprint process, if all goes well, then we have volunteers come in. We have an extensive orientation program. So we orientate a new person to what it's like to be a VA volunteer. And then beyond that, whatever mutually agreeable area you decide to select to volunteer in, then you're trained in your specific duties. So we have a continuing type of education program within voluntary service. When new duties come up, we train volunteers. We also annually train volunteers. So if you're interested in volunteering, really the best thing, contact one of our offices. We can give you all the initial information that you need, and then you can decide if you want to continue on with the process.
It sounds like a lively program. It's not just you come in and spend a little time. It's a serious program for people who want to give. So do you have required hours that you need people to commit to volunteering?
We have basically two types of programs. We have a regularly scheduled volunteer program. Regularly scheduled volunteers are split up into two categories. We have adult volunteers, that's everybody 18 and older, and then we have youth volunteers. Youth are 14 is the minimum age, and they go up to 17, 18, depending. The cutoff point there is if you're still in high school. So if you're 18 in your high school, you're still in our youth program. If you're 18 and you're out of high school, you move on to the adult program. We don't have a specific number of hours that we say you must volunteer. What we're looking for in our regularly scheduled volunteer program is we're looking for people that have some continuity and stability in what they do. So perhaps you volunteer and you come in once a week and you volunteer for 4 hours. Or you might be a volunteer that has more time, so you might come in and you might work 3 8-hour days. It's the continuity, the consistency that we're looking for in our regularly scheduled volunteer program. Now, what I will say with our other program, which we call occasional volunteers, it's predominantly group volunteering, and people come in groups. To be a bona fide occasional group volunteer, you must come once a month. So again, it would be that regular type of visit, might be 3 hours once a month, but it's, and that's our minimum type of requirements for hours. We also ask that all people make a commitment of 100 hours to the program. That doesn't mean you have to do 100 hours in 3 months, 6 months, but the overall commitment being 100 hours. I mentioned the kind of training and stuff that we have. Well, one of the reasons we have the kind of hourly requirements that we ask of people with the 100-hour commitment is because of the amount of training that we put in, the background checks that we do with individuals. We're really not the type of place to come if you want to be an individual volunteer and you want to just come in once or twice and then move on to something else.
We're looking for that commitment to serve the veterans. They deserve it. And what about specific programs where the need might be greater for volunteers throughout the healthcare system?
Because we are so customer service focused, that's really what voluntary service is about, trying to utilize community members through the volunteer programs to assist our veteran patients. A lot of our programs are ones where people would be directly with and around the patients. They would be, again, a hospitality type of volunteer. That could be greeting people as they come into our buildings, greeting people into particular services throughout our facilities. We also have volunteers that go around, particularly in our community living centers, visit with patients, talk to them, the normal types of volunteer opportunities in a nursing type of environment, giving out water pitchers, helping people get set up for meal times. So I would say our greatest need is always for volunteers that are interested being with and around the patients.
And we always like to remind people here at Veterans Health Watch that the VA Maryland healthcare system is more than just 2 locations. It's more than just downtown Baltimore and Cecil County. You have locations throughout the state. So do you have needs for volunteers in those site-specific locations?
Actually, we have 6 outpatient centers, of course, and we're very fortunate that we do utilize volunteers at all of our outpatient centers. In some of our outpatient centers, we have volunteers that do assist with our coffee programs, and that would be individuals that make coffee and help have it available for our outpatients that are waiting for their appointments to have a nice warm cup of coffee. We also have volunteers that help with My Healthy Vet. My Healthy Vet is a huge program that came on board about 3 years ago, I would say, and it's an electronic way for veterans to connect with their health care. We have volunteers that help veterans learn and to maneuver themselves through My Healthy Vet. That would be something that's done at one of our outlier
One of the clinics.
community living centers, right?
Oh, okay.
Clinics. And we also have a huge volunteer driver program. And that is our transportation, volunteer transportation is done for individuals that have a need to get in for their appointments. Sometimes it doesn't do a veteran any good to keep up their health if they can't get in to see the physicians that they need to for their appointments. So we do have a transportation program. There is criteria to be in the transportation program, but volunteers using government vehicles go pick up individuals and then bring them in for their appointment and then take them home afterwards. Now we have 2 locations on the Eastern Shore. We have one in Glen Burnie, one at Fort Meade, and one at Fort Howard as far as what I consider our outlier types of facilities, and we utilize volunteers in all of those areas. So you don't have to just come into one of our inpatient facilities. You can volunteer in our outpatient facilities. And I know I'm not going to go belabor this issue because I know you're going to be talking about it later, but we have a wonderful community-based volunteer program that runs much like a buddy program, and it's called our Caregiver Support Program.
And we're going to go to a break shortly. I have a few more questions before then, though. Can you tell us about the gifts and donations part of the voluntary service program? It's more than just donating your time. Tell us more about the gifts and donations part of the program.
And for some people, time is an issue, and I certainly understand that. But we do have a voluntary service is the service within the VA that accepts all types of donations, monetary and in-kind donations. I'll start with the monetary donations. Monetary donations can be earmarked for what someone would like the funds to go to. For example, we have a homeless veterans program. We have a women's veterans program. Then we have the all-purpose account, which can be used for anything. When you're thinking about giving a monetary donation, the best thing really to do, again, contact one of our offices. You know, people's hard-earned money, I know they want to use it for what it's really needed for. So it's always good to find out these are some of the things that we need monetary funds for. As far as in-kind donations are concerned, they range from the gambit of comfort items as well as, you know, socks and clothing and, you know, those are some I guess some of the really good ones. People that knit and crochet and sew. You know, we have wheelchair bags and quilts and lap robes, those kinds of things. So
I'm sure it's always a good idea for people to call in and see what you need when
it
comes to those in-kind donations as well.
It is.
And you can also give online?
You can. We have eDonate, which all you have to do is go on our webpage, and it's right there. It's very easy to follow, and you can donate right online. When you go through the eDonate program, it actually gives you some of the different monetary projects that we have, and you can select. One thing I didn't mention, but I'll mention now, that is a little different with the VA than it is with maybe some other organizations. 100% of your donation is used for the purpose that you intend it to be used for. Our salaries and overhead dollars comes out of a totally different pot of money. So we don't have to take donated funds and use a portion of it to pay the electric bill or to pay a salary or whatever. So I think that's noteworthy.
Yeah, it is. Susan, what about a family member or a member of the community who wants to leave a portion of his or her estate to the VA Maryland healthcare system? How does a person go about doing something like that?
Well, I would suggest the best thing would be to talk to an attorney about how to leave a bequest. But we certainly are grateful for bequests, and we've gotten some really nice ones in the past few years of individuals that wanted their money to go to assist their fellow veterans.
Susan, what about those family members who maybe want to leave a donation in the memory of a loved one who passed along? at the VA Maryland healthcare system. How should they go about doing that?
Well, and we're certainly grateful for those types of donations as well. The best thing, again, I can't say this enough, is to call the volunteer office. Let us know that that's what your intention is. And at that time, we can let the family know these are some of the projects that are up and coming. And if a family has a particular item or something in mind already, then we can discuss that ahead of time and see if it's an appropriate type of a donation. Any donation that we get, we have to be able to use or we can accept it. So that's why I stress, let us know, talk to somebody in our volunteer office and we can guide you the right way.
Well, Susan, thank you for joining us. This is an annual treat to have you on the show to talk about the voluntary service program. So thank you again for being with us.
Thank you.
We're going to take a short break, but when we return, we'll learn more about volunteer opportunities throughout the VA Maryland healthcare system. So please stay tuned.
Volunteering is an opportunity to show your patriotism.
Most importantly, it's a good feeling knowing that you're helping those who have already served.
And it's always an honor and a privilege to me to be there because I know that I get to help the men and the women who have served us.
So if you're interested in volunteering with us, best thing is to get in contact with us through our webpage, or you can also call us.
It really, really gives me an opportunity to give back, make a difference.
Our veterans put everything on the line to protect our freedom. We may never be able to repay them for their sacrifice, but we can show them just how much we appreciate all they've done. Every day, hundreds of people just like you volunteer to help our veterans. You can help by simply sharing your time, lending a warm smile, a supportive hand, or a sympathetic ear to someone who needs it. Everyone can do something to make our veterans know how much we appreciate their service. What will you do?
It's important to get a new flu shot every year. It's very easy to do, and it can protect you or a loved one from getting sick. People who are at high risk for the flu are those who are over age 50 or those who have underlying heart or lung conditions.
The flu vaccine is offered free of charge. We do the vaccination in various clinics.
You don't need an appointment. You can walk in and get a flu shot when you show up. Thousands of people die from this, and it's preventable by a simple vaccine.
Welcome back to Veterans Health Watch. Today we're learning about the voluntary service program throughout the VA Maryland healthcare system. And joining us to talk about more specific programs are Vivian Newstate and Richard Michael from the Voluntary Service Office. Thank you both for joining us.
Thanks for having me.
Richard, let's talk more about one of your special programs, the Caregiver Support Program. Tell us about how that program works and how volunteers help to benefit the program.
Oh yeah, it's a great program where we bring volunteers into the veterans' homes. We do this for 3 different reasons right now. We have it started as caregiver support, where we have veterans that are receiving 24-hour care from their family member, a wife or son or daughter, and those caregivers really put a lot into the care that the veteran's receiving. So we wanted to find a way to give the caregiver a little break, whether it's to run to the grocery store or to get their hair done or something simple like that. So we bring a volunteer into the home to sit with the veteran so the caregiver can get out into the community, do what they need to do, and not worry about their person at home.
That's a great program.
It is, and that's really how it started. After that, we started adding different aspects of it. Another thing that we've started is socialization visits. We have a lot of veterans that are way up there in age, and they don't get a lot of visitors that come to their home to spend time with them. So we bring in a volunteer that knows, what the veteran's been through or has, has that relationship building interaction with them. So that's the second part of that, the program. And then the third part, we have a lot of veterans that are receiving hospice care in their homes, and we send volunteers in that are familiar with the veteran's circumstances and familiar with hospice care. They've been trained on how to be a volunteer in a hospice setting, and we send them into the home to help the caregiver and the family, just as a way the VA and the volunteers can support the veterans.
And you mentioned training. Are there specific requirements for a volunteer to participate in the Caregiver Support Program?
Well, they would come through our regular vetting process, which is a background check, fingerprint background check, lab work, a volunteer orientation. And then we also do some additional training for the veterans that are just doing socialization visits. They just get a 2-hour training program about what they can and can't do in the veteran's home. And then our hospice volunteers do receive a lot of extra training on how to deal with the process of dying.
It's great to hear that the VA provides support for the volunteer as well.
Absolutely, they do.
And earlier, Susan, the program manager for voluntary service, talked to us about commitment levels. Can you tell us about the commitment level for volunteers for the caregiver program?
Well, each different aspect has a little bit more of a commitment. If they're doing socialization, it can be a little bit less. We still like to have it scheduled, but it could be maybe instead of once or twice a week, maybe once every other week or once a month, just to stick your head into that veteran's home and visit with them for a few minutes.
Well, thank you.
Yep.
Good information. Vivian, I understand you manage the escort program, volunteer escort program at the Baltimore VA Medical Center. Can you describe that program to us?
Sure. So the volunteer escort program is all about helping our clinical staff to have more opportunity to give direct care to the patients. So our volunteers transport inpatients and outpatients to their appointments, as well as any visitors that need some help getting around the hospital.
Great. And what about other sites throughout the VA Maryland healthcare system? Is the escort program available at other sites?
There's no dedicated escort program at the other sites, but there certainly are volunteers that do aspects of that position. So for example, we have greeter volunteers that will help people get to their appointments. We have volunteers through a recreation therapy department that help the patients to get to the activities.
And what about specific requirements for being an escort volunteer?
Well, definitely someone that's upbeat and active, because you're going to be running around the whole time that you're volunteering, and you need to be able to push a wheelchair or a stretcher for the patients. As well as Rich talked about commitment, I do ask for a commitment from the volunteers, so that way we're able to staff the program.
Well, I had the opportunity to interview one of your upbeat and active volunteers, Mr. Larry Williams, so let's go to that interview. I'm here at the Baltimore VA Medical Center to talk to Mr. Larry Williams, a veteran and a volunteer for the VA Maryland healthcare system. Mr. Williams, thank you so much for joining us today.
Thank you for inviting me.
So what made you decide to be a volunteer?
Well, being a United States Navy veteran, disabled, I was home twiddling my fingers, had nothing to do when I'm able to work. Talked to my physician, she said, why don't you volunteer at the VA Medical Center?
That's a wonderful idea.
Yeah, and it was the best thing I ever done.
Well, Mr. Williams, I understand you're a pretty busy man. You have 2 volunteer positions. How's that working out for you?
Yes, I do. I started off being an escort down here at the VA Medical Center, for which I take the patients to and from for their appointments. I also do the home caregiver support system, where I go to the patients' homes, I play cards, I read with them, I chat with them, and my time is depending on how much care that they need, and that's the time I give them.
Tell me a little bit more about your volunteer escort position.
Well, down here at the VA Medical Center, what we do, we'll sit up here, come in our meeting area, and wait for a phone call to come through. We'll come get the phone call, take a patient to their appointments, then we'll come back here. When they call back, we go get the patients from their appointments. And then, like I said, we talk to the patients, and they be telling us how they, oh, come on through, come on through. And for example, here's one of the patients that said they be in the rooms all day, talking to doctors and nurses, but they never get a chance to talk to anybody else. So a fellow veteran or some retiree that takes them back and forth and gives them a word of encouragement makes the day a lot better.
That's wonderful, Mr. Williams. You sound like a busy man who enjoys his volunteer work. What would you say to someone who's sitting at home, maybe in the position you were in with nothing to do, or a person who is even considering volunteering? What would you say to that person?
I would recommend it to anyone to come down here to see the volunteer specialist. They will train you and help you in any experience, the training that you want. Also, if you give an assignment that you don't like, they also will train you in something else to make it more easier and better for you. So I would recommend it to any disabled veteran, any retiree that wants something to do and to encourage someone else to come on down to VA Medical Center and help out with the escorting service or be a home care support system. It's a wonderful opportunity to go in someone's home, to say, hey, I'm here to support you, give the family a chance to take a break. It's a wonderful opportunity.
Well,
so I recommend it.
Thank you so much for joining us today, for sharing your experiences, and for all you do for veterans.
Thank you for inviting me.
It sounds like Mr. Larry Williams really enjoys his volunteer experience with the VA Maryland healthcare system. Vivian, for escorts, how do you go about selecting and making that right fit for the volunteer?
Sure. So first I sit down with the individual and kind of go over what are the responsibilities of the escort, some suggestions. So that way, if it does sound like something that they might like to do. When they go in that first day, they have an idea of the circumstances that they may come across while they're volunteering. It takes a little bit of practice. They have to get to know the hospital, but generally they'll shadow another volunteer that's experienced in the area for at least the first few times when they come in.
It sounds great. I know the veterans really appreciate having that one-on-one contact with a volunteer who's interested in them.
Absolutely. And because they don't do any clinical work, they know that they're not going to get a shot or have to take any medicine. So I think, they're definitely happy to get out of their room for a little bit and just talk to a friendly person.
That's great. And Rich, back to the caregiver support program, you described it beautifully. So I'm sure that someone sitting at home and thinking, okay, I could use a little break. How can that person learn more about the program, or what should they do?
Well, the first thing is they have to be enrolled in the VA as a veteran patient. After that, they can either contact their social worker or their primary caregiver, and the social workers have a form that they fill out and send over to us. Once we receive a referral through one of the caregivers, we go out and inspect the home, make sure it is a place that we'd want to put one of our volunteers, on a regular basis, and then we choose a volunteer that has some of the same interests, maybe lives in the same area, so we can ensure that they're going to be committed to their visits with the veteran. If there's somebody out there that is enrolled with the VA and just wants to give us a call in voluntary service, I'd be happy to talk to them more about the program.
And that's what I was going to ask about, any of the programs under voluntary services. If someone is interested and they want to learn more, how can they get in touch with you all?
For the caregiver support, my number is 410-605-7000, extension 4613.
Or for voluntary service in general, you can call the Baltimore VA at 1-800-463-6295, extension 7100.
Well, thank you two so much. We've learned a lot about the volunteer program, and that is an actual structured program to really benefit the veterans throughout the VA Maryland healthcare system. Thank you for joining us.
Absolutely. Thank you, Kenya.
Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101. Or you can visit us on our webpage at maryland.va.gov. And remember, if you are a veteran or you know a veteran who is not enrolled in the VA Maryland healthcare system, please call us, visit one of our facilities, or visit our website. We love to serve you. We look forward to hearing from you. Please join us next time.
Applying for the VA healthcare system is one of the best things you can do for your health and well-being.
A lot of veterans, for some reason, don't realize that they are eligible for VA healthcare benefits.
So we always encourage the veteran to call because each veteran is enrolled on a case-by-case basis.
Once I obtained the knowledge that I could enroll, I enrolled, and it's been a great decision ever since.
A veteran can learn more about eligibility for VA and health care at 1-800-463-6295, extension 7324.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and share common experiences with.
The amount of medical attention that I received has been excellent.
The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.